But if you were to give women a few tips on how do you advocate yourself in such a structured environment, what can they do?
I believe that advocating for yourself in labor is not the right thing to do. You are not in the right mental, position to do that during your labor. And I also believe that it's not, it's so sad to ask women to be advocating for yourself, or you should be like completely letting go and being vulnerable and just being like into your labor and into your body, right? So that's why I would say the advocating part should be before, during the pregnancy.
Hi, everyone, and welcome back to another episode of the Madinat Mom Podcast. I'm Nour, your host, and today's guest, Houyem, is a mom of 3, an integrative women's health coach, birth worker, and yoga instructor dedicated to guiding women back to the wisdom of their bodies. She offers holistic health coaching, body literacy education, and birth support and education rooted in connection and informed consent. Passionate about supporting women throughout their female life experience from menarche to menopause, including pregnancy, birth, and postpartum, Houyem creates a safe space for women to feel seen, heard, and supported throughout. Her work is grounded in the belief that when women really understand their bodies, they reconnect with their power. So make sure to stay tuned to the end of this episode because you don't want to miss a thing. Thank you for being here, Houyem.
Thank you for inviting me, Noor.
So lots of interesting things that you're working on. Can you tell us a little bit about when did this interest start?
Yeah. So I think I'm gonna, of course, give you the short story, but I've always been interested into like women health and pregnancies and babies, like since I was a little girl. But and of course, life goes on, and I went, studies and went into the corporate world, and I got really disconnected from my body until in my early 30s when I wanted to conceive. I was ready to have a baby, and I realized that I knew nothing about that. Of course, like the basic thing, but I knew nothing, and I was like, how can I know nothing at my 30s? So I just like stopped and started to read about like fertility and conception, and I think this is where a world opened to me. I learned about fertility awareness method, which is this whole concept of knowing your body for conception and contraception in the natural way, right? I learned about the fertility awareness method, and then I conceived my daughter, and I had a beautiful pregnancy. I had a beautiful birth. At that time, we were living in Canada, so I had the opportunity to give birth in a birthing center with just a midwife. And I think from there, I just wanted to share what I learned, what I knew with other women about their bodies, about fertility awareness, and about birth and the whole journey. I would say from pregnancy to postpartum.
And you have 3 kids.
I have 3 kids. I have a 10-year-old daughter and 2 sons of 4.5 and 2.5.
Okay. Did you have them all in Canada?
I have my first in Canada. I had 2 boys in Dubai.
Okay. Did you feel like there was a difference in the kind of support that you got in Canada as opposed to the kind of support that you got here?
Yeah, I think the support was completely different. So in Canada, I was supported by a midwife throughout my pregnancy. So it was very holistic, and we had like an hour-long appointment where I was able to discuss everything, from like my fears and questions about my body. I felt that we had this space where we were supported, holistically. Here, I decided that I really knew a lot about that point about pregnancy. I was way more confident as well about my body. So I decided that I didn't have to have all these appointments and obstetrical appointment. I had few, of course, but I've decided that I wanted to choose what I was going for. I decided to limit as well the ultrasounds and the test, because it's not something that I believe was necessary for me. So in that sense, even if the support provided here was way more medicalized, I felt that I also, took space, and I was like the authority in my birth experience, and I decided what I wanted to do and what I didn't want to do. Yeah.
That's actually very brave, very impressive. As an expecting mom, I literally wait for my ultrasound appointments. I can't wait to actually go and see how is the baby developing. So I think it goes to say how much, in connection you are with your body. And I can't wait to get into this conversation a bit more. But how was your postpartum experience? Did you feel like coming from the space, being in connection with your body helped you recover? And did you get any external support as well? Or did you feel like that was a gap also that was lacking?
Yeah, so I think coming from my origin is Tunisian, my husband is Algerian as well, and it's something that we take very seriously in a sense. My mom and my mother-in-law were here, and we prepared it as well. I knew, from all my teaching, my readings, I knew it was something important. So for my first, we flew my mom and my mother-in-law to Canada with us. They stayed with us for 1 month, and they basically took care of us while I was breastfeeding and taking care of my baby. So I really made sure we had the support because I knew it was important. And for my second it was during COVID, so we didn't have all these, so all the support. So it was challenging, but my husband also we took space, we took time to prepare as much as we can and to have the necessary support, right? So I think for us, it was my postpartum was always a key element of my recovery. So I made sure I took the time to prepare it accordingly. So to have the right support, I knew the foundations, in terms of like nourishment, in terms of, what is important in terms of self-care for my body. So I always took the time to prepare my postpartum as for me, it was as important as the preparation for the birth.
And when you talk about a holistic approach to pregnancy, can you explain a little bit more about what you mean?
Yeah, so for me, what I mean is that I think, unfortunately, in the modern world, we think of a pregnancy like just a physical experience. Okay, it's just you have a baby growing into your body and it stops here. And it's really not for me. It's really something that is related to your physical body, but also to your emotional, body. It's a spiritual experience as well, and it's really a holistic approach. Is making sure that you take care of all these elements. That of course you take care of your physical body, you nourish your body accordingly, but also you make sure that you make space for what you're living. So I think as women, often what we don't do is setting boundaries during our pregnancy. We leave all these like negative interference coming into our space with like unsolicited advice, from everybody, and people who tell you, what to do, people who share their horrible birth experience because they feel they're entitled to do that because you're pregnant, right? So, and as women, we often people pleaser, and we often don't, we don't want to trigger people, so we don't say no, I don't want to listen to that. So we don't protect our space, we don't protect our boundaries. We don't listen to our fears as well. We live with our like pregnancy, birth fears. We don't tackle them. So for me, it's also that. It's also really listening not only to what your body is telling you, but what is your mind telling you. We are so w- like brainwashed with all these horrible things about birth, and for a lot of women, they live with that all their pregnancy, and it comes up. It's gonna come up at certain point. So instead of leaving it coming up, I think it's important to handle those fears, understand where they come from, getting the right information to really go through this journey with as much confidence as possible.
If you were to break down the factors that are negatively impacting a woman's hormone health during pregnancy, what would those be?
I think the most important would be the foundation. When I say foundation, is like a good like nourishment, like having a very good diet. And I don't like necessarily the term diet, so because I really feel that women tend to really eat less than what they're supposed to eat, right? So eating like a diet rich with good wholesome food that really nourish the body. I would say that would be the foundation. Good water, a good lifestyle as well. A lot of women are told by their doctors that they can't. move or they have to limit their activity. And I think this is very detrimental. If you're a person who used to have a physical activity, there's no reason except in few cases where you could not like continue your physical activity during pregnancy. I think we need to also get away from this paradigm that pregnancy means like we're like sick or like incapacitated in some way. I think pregnancy is a synonym of like vibrancy. Your body is able to grow a baby. Like I think there is no other like synonym of health, other than that. Of course, there are discomfort, sorry, but we are healthy, and it doesn't mean that we have to like stop everything. So I would say the first thing for me is the foundation, like diet, lifestyle, good water. The second thing is that how do we make sure that we also take care of our nervous system? How do we put boundaries when we need to put boundaries? How do we say no when our body and our mind wants to say no instead of saying yes to everything? Yeah, I think that would be a big one. And another one as well is taking care of our heart by, taking care of our fears. What is bothering us? We're sometimes so paralyzed by our fears of like pregnancy, birth, and postpartum that it does not allow us to take like the decision that we want to take. So I think it's that. I think it's the main one would be that. Yeah.
I'm surprised that you're putting an emphasis on setting boundaries. I can imagine it has an impact on emotional well being. How important is emotional well being in achieving hormone harmony during this time?
Yeah, because if we are paralyzed by fears, again, if we're paralyzed and we can't move, we are also triggering cortisol in our body, which is a stress hormone, right? And the stress hormone creates also inflammation in our body. And when we have chronic inflammation, it leads to different diseases, right? So taking care of our nervous system, tending to our nervous system, make sure that we have like healthy cortisol level, and that all the rest, all our hormones are at like optimal level to support our like overall health, I would say. So that's why I think this is why the holistic approach to pregnancy is important. It's not about the physical body, it's about your emotions, it's about your nervous system, it's about your heart, and being able to feel, you know, like you're making decisions as not without being paralyzed by fears of your emotions.
Mhm. So you talked about the factors that can positively influence your hormone health and your hormone balance during pregnancy. Are there any environmental factors that are impacting us negatively without us knowing?
Yeah, look, I think of course we all live in a world where we are exposed to so many like environmental disruptors and hormone disruptors in our daily life. Of course, the all the scents now that we're exposed to, of course, are like water, food, etc. And I always go with the principle that we cannot control everything in our environment unless we decide to pack our bags and go live, in a farm far away from here. But it's not available for everybody. So I think what's important is there are a lot of things that we control, a lot of things that we don't control, but let's focus on things that we control. And things that we control are things that we put in our body, right? So choosing like, of course, great food, having a great like filtering system at home to really hydrate with ourselves with good water, having like an active lifestyle, and of course, as I said, the mental and emotional aspect is often like underestimated, but this is something that we can control, and that has a huge effect on our overall health.
And when we talk about things that we can control, I think that brings me to the next question that I have about informed choice. The work that you do is rooted in connection and informed choice. But how can you tell us a bit about how is informed choice different from consent?
Mhm. Yeah, so informed consent comes. It's a legal principle, and it's driven by, I would say, the care provider. So care provider will give you the information. Sometimes, honestly, it's not often all the information available, and you have the right to you can consent or no to any medical intervention and medical exam. Unfortunately, as I said, not all the information is given at that moment, and sometimes there is also a lot of like fear or coercion as well inside, in the mix of informed consent. But for me, informed choice comes from the person. It comes from the woman herself, where she has the access to all information and she's a decision maker. So no one is a decision maker except her. And of course, the care provider will, facilitate her choice. But this is the difference that I see. Consent comes from, it is led by the care provider, while informed choice is led by the woman herself.
And how would you recommend for women to become more informed when it comes to pregnancy and birth? Because we can do a lot of research, but research sometimes can come with a lot of anxiety and stress because we don't know, the value of what we're reading. So, what are some steps that women can take to become more to gain power in their journey?
Yeah, yeah, yeah. I think I always say, and that's why after birth work, I started to also support women through fertility awareness method and through like hormonal health and menstrual cycle issues, because I truly believe that if possible, it doesn't start at pregnancy. It starts way, way earlier. Like my daughter is 10, she's a preteen, and this is where it starts. Giving her the confidence that she can connect with her body, that her body is beautiful, that her body is not broken, that it's amazing to be a woman. I think it's up here because when we build that confidence, that connection with our body, it becomes then, pregnancy just becomes another life stage. It's not something to be scared of, right? So ideally, and this is why I'm so passionate about that work, is that it starts with our girths, right? Of course, again, it's not available for everyone. And I know women who really had like a wake up call during the pregnancy, being like, oh my God, I know nothing. I know nothing about my body. So what I encourage women is to get informed and to get educated, to choose the right sources, ideally independent sources that will not be impacted by, any, I would say, profit or any, what I mean is that I think the most important is that women get the right sources of information. I wouldn't go into like a Google table search and things like that. But there are a lot of providers here, I would say in the region in Dubai, that provide like prenatal, independent prenatal education, hypnobirthing classes that are independent, I would say, from the medical setting. What I see in the medical setting is information about how to be like a good patient, how to follow the steps. We're gonna come, you're gonna be checked in, and then this is all the steps that we're gonna do. So honestly, the information that is provided is very limited. That's why I said it's always better to go through an independent source. Again, there are a lot of companies that offers that. There are a lot of women who are childbirth educator that offer this information in a more independent way. There are also lots of sources online where you can find courses. And I think it's about women to find the right, things that resonate the most with them. I always say it's always important to understand the physiology of birth, understand the basic, how we're designed, how we're supposed to give birth naturally, because that's the base, right? And then, of course, you can learn about all the intervention, etc. But I think having the independent birth education, that would be a first step.
Mhm. And speaking of birth, what are your thoughts on a birth plan?
Yeah, okay, so I have mixed view about that. Okay, so I think a birth plan is great for the woman herself to help her clarify her birth vision. Because often when I meet, couples and women who want to prepare for birth, and when I tell them, what do you want? They always start telling me, oh, I don't want that. I don't want to have C-section. It's always, the worst case scenario. And we lost the ability to really think about, what does my heart really want for this birth? What can I make this experience the most beautiful and powerful for myself? I think when I ask these questions, often like, what do I want? And, most women are lost and like, I have no idea. So I like the idea of a birth plan because as a journey, right? Not necessarily like the objective is not to have like a final document. The beauty of a birth plan, creating one, is about the journey. Because during the journey, you get to ask yourself questions. You get to also understand clearly your values, have more clarity about what you want and what you don't want. Ask questions, be informed. So that's what I like about a birth plan. It's this, process of you asking questions and understand more and more about what is important for your birth. The final document is, we say it's used to be like a document that you give to your care provider or the hospital. And often it's not something that they read necessarily. But I would say if you want to prepare one, and if you want to, I think it's important that your birth partner or your husband knows about it and is clearly like aware of all of it, so he can also advocate for you during the birth process.
What are some important things you would say to include in a birth plan that we often leave out? Because we focus on the hospital checklist, right? But what are some things that you would encourage women to include in the birth plan?
Yeah, I think it's important to put things like any support, any tool that you would like to bring from home, the things that you would like to have, for example, access to water birth, for example, even if it's not something that you necessarily want, but it could be like a way for you to handle the labor. What type of pain relief or not pain relief you're okay with? I think it's important. And something that we often overlook is the afterbirth, the birth of the placenta, how you want it to happen, the baby care as well. You want your baby on skin to skin, you want to breastfeed, you don't want anything, to be, and no intervention to your baby unless you're here, and things like that. I think we often overlook the part after birth, but it's important to also include it in the birth plan.
Mm-hmm. And you mentioned a lot, the fear of C-section. I think we see that in this region a lot. But in your opinion, to what extent do women have the right, not the right, but the ability to put that in the birth plan and say, no matter what, I don't want to go into a C-section?
Mhm. I truly believe that what I say to women is like, don't put it in your main birth plan. Just put it separately in case there is something happens. You can put it separately, but in the birth plan, just don't mention it, and then you can mention it in a separate in case it happens. But I would say it's not necessarily something that needs to be discussed in the birth plan. I think everything related to birth choices need to happen before. And there are ways to avoid a C-section, because a C-section is, of course, a life-saving surgery. But unfortunately, in our modern society, this is way, 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 this is often, an intervention that we do without necessarily being evidence-based, doing a C-section because baby is too big, or because, we're over 40 weeks. It's not even evidence-based, unfortunately. So I think the more women are informed, the more women are, know about birth, the more they could be, they would be equipped to have this discussion with their care provider.
We're taught to fear birth pain because we don't really understand what's going through our bodies at that time. And I know for, myself, my first experience was, it was amazing. I don't like to say anything otherwise, but of course it was painful. And looking back now, I realize I don't really understand what my body was going through. Can you tell us a little bit about what our hormones are doing during labor?
Yeah. And I love this subject always, because this is one of the main questions when I support women, is like, how do I avoid pain, right? This is one of the main things. How do I avoid pain? And, for women who don't want to medicated birth, like, how do I avoid pain naturally? We're so focused on pain. It has become, unfortunately, the highlight of our birth experience, when it is not. Yes, there could be pain, and it's very subjective, right? For some women, will experience pain at different levels. So there could be pain, but there are also so many other things, right? There's pain, there's, joy, there is excitement, there is a lot of different emotions, during the birth process. And we don't necessarily have to avoid pain. I think when we really trust our body, there is something that beautiful that comes with birth experience that is above, like, okay, avoiding pain at all costs, right? I think, and we always go back to body literacy. I think it's important to understand why our body, why do we have these sensations. And it's beautiful when I explain to women that I support, like, what is a contraction, they're like, oh, okay, this is it. I'm like, yeah, this is what your body is doing. And I think the more we fear, the more we experience like pain because our body is tense and it's going to be like worse, worse physical sensation. The more we relax, the more we like trust what our body is doing, automatically the pain level, the sensation level will decrease. This is amazing. And without going through the whole like hormonal blueprint, but we have our labor starts with oxytocin, which is the hormone of love, which gonna start, creating the contractions. And after a certain time, our body will produce a hormone called beta endorphin, which is our natural painkiller. These are beautiful that we have like in our body, embedded in our blueprint, this hormone that is supposed to be our hormonal painkiller. And this is why, when women enter a certain phase in labor, when labor is active, and it's not medicated, they just go into like an altered state of consciousness. They tend to close their eyes and be in their own bubble. And this is where we know that beta endorphins has kicked in, and it's like it's on. I think it's a Mexican proverb that says that women in labor, their soul leaves their body and goes to go to the stars to get the soul of their baby and come back to earth. And I always love this because I always felt that during my labors, where at a moment you're like, you're not really here, you're away somewhere. For me, this is what happens. So I think when we understand again the hormonal blueprint, we understand what happens in our body, there is no fear, there is no reason to fear our body anymore. We just have to work with it and let it do what it needs to do.
You talked about explaining what a contraction is. Can you tell us a bit about that?
Yeah. So a contraction is, so our uterus is, oh my God, it's a magnificent organ. And before we are pregnant, it's just the size of a tomato, right? And at the end of the pregnancy, it's huge. Of course, it's the size of could be the size of a watermelon. And the uterus is composed. It's a muscle, and you have different lining. Lining of muscles. So a contraction is just a muscle contracting and building a fundus at the top of the uterus. So all the muscle will contract to create enough force or enough pressure to then push baby down. Right, so it's just the uterus contracting and creating this pressure on top to push baby down.
But meanwhile, in the delivery room, you have like, there's just so much noise. It's chaotic, Do you think sometimes something we include in our birth plan is like the music, the environment? Do you think those aspects actually play a role in helping you relax?
I think it's secondary. I think the first thing would be, who do you have in the room? And we have control about that. We have the right to decide who is in our space or who we don't want, right? And so I always say women as well, the most important is that, like, of course, if you have like a healthy pregnancy or all is right, you don't have to rush to the hospital the moment you have a pregnancy, right? You can stay at home and where you feel safe until you feel ready, and then you can go. And when you go, it could be a part of your birth plan as well to say, I'd like just one nurse or one midwife to be with us all the time. I don't want anyone else. And something that people don't know as well is that, and it happened like very few times when I supported birth at a hospital, but when the nurse or the midwife was taking care of the mother, was, I don't know, the vibe was not there, and there was, she's very like talking loud, etc., etc. You have the right to say, look, I prefer to have someone else. I'd stop, I'm sorry, you're not my vibe. This is my birth, and I want to have someone else. And I think we're scared to do that. We think that because we're here and we are like, we don't have to say no to anything. We have to do, we have to comply to everything. And no, we have more power than that. We can say, no, I don't want to you. Please bring someone else. And like you have the right to refuse anything you don't want to. Right. And I think women have to also understand that this is our body. This is their body. The hospital doesn't own you because you're there. You have the right to say, no, I don't want to do that, or I prefer to do it later. Let's see, I prefer to, we have the right to.
Yeah. Speaking up is part of advocating for yourself. But as you said, I think women are afraid to do that because of the consequences. They fear the consequences and they wonder, but what if, this doctor actually knows better than I do. But this all goes back to going into this experience with knowledge and information and speaking up and just saying, this is the person I want in the room. This is my safe space, and then turning labor from fear and pain into something different, something more beautiful. So I love that you talked about that. But if you were to give women a few tips on how do you advocate yourself in such a structured environment, what can they do?
I believe that advocating for yourself in labor is not the right thing to do. You are not in the right mental, you know, position to do that during your labor. And I also believe that it's not, it's so sad to ask women to be advocating for yourself, where you should be like completely letting go and being vulnerable and just being like into your labor and into your body, right? So that's why I would say the advocating part should be before, during the pregnancy. So being informed, knowing what is right for you, like having clarity about what you want for your birth, this is a big step of advocating. Being like, this is what I don't want, and this is what I want. And then making sure you make this happen. You can decide to choose another doctor if doctor is not aligned to what you want. And I know a lot of women who change doctor at 38 weeks because they're like, okay, I've discussed my birth choices. We're not aligned. I'm going to choose someone else. So this is advocating here. This is choosing the right people that are going to support you. Because doing that at the birth setting is, a step too late. The second thing that is also very important is making sure that your birth partner, your husband, trusts you and is aligned to what you want, and he is going to do that. So it could be a birth partner, it could be your husband, it could be your doula. So the person or the people who are going to be with you are going to take that role, making sure that they act like a tampon between you and the staff, making sure that they are mediating and they're telling, no, she doesn't want that, or can you. So this is their role. But I would not recommend to the woman to be like an advocating, person during the birth.
I love that you emphasize the role of the partner as well, not only in birth, but also from pregnancy and birth and in postpartum as well. So, Houyem, I love that you emphasize on the role of the partner. And can you tell us a little bit about beyond the birth, going into postpartum, which is a very vulnerable and sacred period that the woman goes through? How can her partner support her during postpartum?
Yeah, I think again, it's something that has to be prepared and discussed before birth. I think it's important that the partner is aware and is extremely like sensible to the fact that it is a very critical time for healing, for embracing, the new journey, whether you're a mother of 1, 2, or 3. I think the partner has to be sensitive to that. That this is critical, and I have to make all things possible so that my wife and the baby are supported to be able to like, learn to breastfeed and rest, etc. So I really see the partner as the person who's going to make sure that everything falls into place. So I think so, and again, it's going to depend from partner to partner. Some partners are more comfortable in taking a little bit more, like a more active role in like, making sure like cooking meals and, taking care of like other kids, etc., etc. I think some partners are very comfortable with that. If a partner is not comfortable into doing all of that, I think he has to make sure that there is that the support is here. I think that's the most important. Sometimes also we tend to put a lot of responsibility into partner, knowing that this is something that they have to do. And it's not always the case for everybody. And I think we have as well to, acknowledge that. And that's why the discussion before birth are important. This is what we need to do. We need to plan for the support, meals. Are you going to be available as well, from work and things like that? This needs to be discussed, and then decisions can be taken accordingly on who's going to take which role in terms of like, is it the husband's going to prepare like all the meals? Do we need like support? Who's going to stay with the mother while the partner is away for work for the first few weeks? Everything needs to be put in place, and this is where like we talked about birth plan, but I think having a postpartum plan, it's even like, I would say, like as critical as as a birth, but even more important for me.
Mm-hmm. What would you include in the postpartum plan?
So I would include who's going to be the main or the main support or support person, right? To be with the mother and the couple for the first few weeks. I would include meals as well because we tend to forget. We tend to eat really like on the go. Well, while it is a foundational aspect of postpartum. So making sure that the mother is well nourished. So who's going to support for meal prep? uh, who are the main support for breastfeeding as well? Do you have numbers that you can call day and night if you have an issue with breastfeeding? If you have other kids as well, who is going to support them during this transition period? Who's going to do like the pickup from school and daycare? Who's going to be there for them while the mother is breastfeeding? So I would put all of these as a woman as well. What are your self-care practices that you want to include, which could be like massage, womb steaming, belly binding? Are you like, does one of these resonate with you? Is it something that you want to include in your or in your postpartum? All of these can be put in a plan and, placed into, what your postpartum could be for the first month or so.
Mm-hmm. And in the Arab region, we have this 40 days postpartum rest. Um, do you think that the postpartum plan should be for those 40 days, or do you feel like it should extend beyond?
Yeah, honestly, I don't know when the postpartum stops. I always feel that after, I always felt this way, and it's the case for a lot of women that are supported, but there is a shift around 2 years where you feel like, oh, I'm back into my body. So I don't know again if there is like a specific time frame for postpartum or when it stops. However, I always feel and think that the first like 40 days or the first 4 to 6 weeks are critical. This is for me like the first the very this is a very vulnerable time for the mother where she starts her healing process. She learns to breastfeed, where her body has been depleted, from pregnancy and birth, and where she really replenish all of the vitamins and mineral, where she needs to be supported as well from an emotional and mental perspective as well. So yeah, I don't know when postpartum stops, maybe 2 years. However, the first 4 to 6 weeks, I would say even like the first 3 months is such a critical time that needs to be like planned accordingly.
Mm. And why do you think there's such a gap in the postpartum care that we get?
Yeah, I think like a lot of different things we forgot the beautiful, important, traditional and ancestral values. I think our modern world has, we rush into everything, we rush into our life, and it's the same thing. We rush after birth, you have to rush and go back to your life as soon as possible. So in that sense, postpartum is not important, or a week after. And we see also everything. We see like women bouncing back, after 1 or 2 weeks. And, we have this idea that rest, I think, has a very negative connotation in our society. Like rest means laziness, right? So after you have a baby, you have to be back on track after a couple of weeks. If not, like, what are you doing? Unfortunately. Unfortunately, but I think more women are, more aware of that. I think when we see like postpartum depression increasing, women going back to work and going into burnout, we see the effects of in the babies, in the family, in the couple. I think we realize that we have to go back to basic and tend to that women's health postpartum.
You touched on postpartum depression. What are the main factors that impact postpartum depression?
Yeah, so for me, the main factors would be, unfortunately, it starts with birth as well, right? It starts with, having a traumatic birth, a birth that did not go as, planned, or a birth where a woman felt completely passive. Okay, because it's a major life event, right? And women who had like traumatic birth then go home and they have to take care of the baby, and they're like, like, we call it postpartum depression, but it could be like post-traumatic stress disorder. It's like you are in major PTSD or frozen, and now you are asked to take care of a baby. And I think the second major thing would be the lack of support. Again, you women go out from hospital and then, they go home, their partner go back to work after 5 days, and they're completely left alone with this small little baby. Their body is healing. They have to transition into this new role, from like to become a mother. And it's so big and it's so intense and it's so raw. And they are asked again to bounce back and to go back to their activities. And like, of course, I mean, who wouldn't like, like it's really normal that the effect is so intense into women with that. It's so normal that women go, like, they're asked to go back to their lives and they go to the mall or to do grocery shopping after 1 week, with their baby, and they just freeze. They're like, what am I doing? What's happening? Where is my life? Right? Yeah, I think I would say these two major impacts of birth, traumatic birth, and the lack of support after birth.
Mhm. There have been studies that show that the prenatal vitamins can impact a woman's recovery and going into postpartum depression. What are your thoughts on that?
So I have different thoughts. I really feel that the vitamins come in different. So there are vitamins and vitamins, right? There are some that are very like bad quality. So I think it's important in terms of prenatal vitamin to use a very good prenatal, like a very good quality vitamin. I always emphasize that food is a primary concern. Having like a bad diet and then having prenatal supplements will not do anything. Prenatal vitamin comes into like a more of a support, I would say. And the second thing that I would say, I think we take these prenatal vitamins that are a cocktail or mix of different vitamins without understanding our own needs. And we don't have all the same. Some women will have more needs into vitamin B6, some other will have more needs into vitamin D. So I think instead of taking a mix of prenatal vitamin, I always recommend women I work with is that if you feel that you need them, above your diet, have a blood test to understand where are your what are your specific needs, and then you take vitamins that are that will address your needs, and not like a cocktail of a mix of vitamins.
That's very interesting, actually, because you're right. The multivitamins that we're given are a mix, right? They include pretty much everything except vitamin A, maybe. But I don't know how many times the doctor actually goes into what vitamins your body really needs. And going back a little bit into postpartum, how do you think women can support their hormone health and their recovery after giving birth?
Yeah, I would say again, we have to go back to foundations. We have to go back to making sure that we are properly nourished. Really, that's the base. Making sure that we are at postpartum, we eat a whole some diet mean with the protein, good fat, warm stews and broth. And I think this is where we need to go back as well to our ancestral traditions. And often when you go and look around the world, it's beautiful to see that this 40-day time is not something that is confined to one region in the world, but it's everywhere. And also one of the common practices is about nourishment. All traditions around the world have like this special dish or few dish postpartum that is often like a warm stew with vegetable and meat and lentils and things that are very, very rich for the body to heal and recover. So I think going back to these traditions that we have, I think it's really, really important. When I support women, I'm like, where depending when they're from, I'm like, what are the traditional postpartum meals, in your country? They're like, oh, so and so. And I'm like, yeah, just go with that. So I would say nourishment, the way we feed ourselves will be very important as well. The way we are supported as well. Again, we always go back to the nervous system. This is such an intense, chaotic time, right? So we need to make sure that we are supported, right? That we make sure that our nervous system is, tended to, that we're not like overstimulated, overstressed, that we have a support person when things are too much. We can rely on someone to talk to get advice, etc., etc. And this is what, in my sense, can make a postpartum be like beautiful and blissful, and not necessarily this like chaotic time.
And in your opinion, what are some ways that family and friends can play a role in the postpartum recovery?
Yeah, I think really postpartum is it's not only like just a family concern. One of my teacher, I did a beautiful training with her. Her name is Rachel Garcia Seliga, and she always says, when you look at the health of a society, look at the health of mothers. And when you see like increasing rates of postpartum depressions and burnout, in mothers, that the society has a problem. So I would say that again, people have to be sensitive that a woman in postpartum needs tending, needs to be supported. So I would encourage, for example, women instead of, I have nothing against, baby showers and things like that, but I think making sure that the woman is supported in another way, maybe instead of buying things and, things for baby, let's organize for a meal train, making sure that the woman has a warm meal, like warm meals every day for the next 2 weeks. That the community, that the people can support her that way, that they don't have to come, to see the baby and be entertained. They can just, leave a meal and just go and ask the mother, what do you need? Instead of coming and, seeing the baby and what do you need from us? And we'll provide it for you. Can I take your kids to the park? Let me take your kids, I have a play date with my child, so you can rest, etc. So I think we need to create this village, this community around mothers. And always make sure that when we have a new mother around our circle or pregnant mom, making sure that with few friends, and it doesn't take a lot, right, making sure that we create this community net around her, making sure that she's supported during the first few weeks.
I think that's very important. It takes a village. But as you said, if the mom is not supported postpartum, it has longer term effects and impact on the mom and on society and on the kids. And I think that's something that we forget and we don't see. And we think that postpartum is just a period, it will pass, right? But you're saying it actually won't, and it will impact the mother in so many different ways. Is that correct?
Yeah, exactly. Imagine just a mother who had like a traumatic birth, who doesn't have support, who is on the way to a postpartum depression. So she's not able to take care of her child anymore, her baby, right? Imagine the effect, of course, on her baby. Imagine the effect on her couple. Imagine the effect on her health when she goes back to work after 2 months and she's burned out, right? So it really kind of radiates to all the society. It's not just confined to the home, right? Then you have all these women who go back to their activity that are completely burned out, who live with, depression. And then from a postpartum depression, it goes to like, another type of depression, longer depression. So that's why we have to protect that very vulnerable but so important phase in the life of a woman, because the woman and the mother is the backbone of the family, right? And a healthy, vibrant mother will, like, her vibrancy will just again radiate to everyone in her family.
Okay, I think honestly, Huyam, everything we've talked about is just, it's amazing that there is so much that we don't see, we don't work on as women, and I'm going to be the first one to admit, I think for the longest time, I wasn't connecting with my body and with myself. And when I got pregnant and when I went into labor, it's something that I realized. So for the women out there that are listening, how can they work with you? Are you offering any specific coaching programs that you want to share?
Yeah, so I work mainly in one-to-one with women. I have some workshop that I plan for later in the year, but at the moment I really work on one-on-one for women who are looking to heal their body. So menstrual cycle issues. I work with a lot of women who have PCOS, endometriosis, women who want to learn about their body, who want to learn fertility awareness, to try to conceive naturally or have natural methods for contraception, who don't want to use birth control. I also work with the women who want to prepare for their pregnancy, their birth, women who want to work for postpartum as well. And I also support women who are going into perimenopause and menopause. So I would say that it's never too late to heal our bodies, and it's never too late to really find and nurture that connection with ourselves and our body.
That's amazing. We'll include all of the links in the show notes below. But to move on to a fun section that, I always like to touch on, it's called Mythbusters. And we're just going to go over some myths and maybe some questions as well. And tell me your thoughts on each of these statements. The first one is birth control pills regulate your hormones.
Yeah, that's a big myth, right? So birth control pill do not regulate anything. Birth control pill have the role is to really to cut the connection between our brain and ovary to stop, right, our hormonal blueprint for ovulation. So it does not control, it does not regulate anything. It just stops our ovulation. It will prevent our ovulation.
hmm Um, would you advise against birth control pills?
So when I work with women, I would never tell them what to do, what not to do. I will give the information and they are free to take it or not take it. I think this is what's important for me, that women have the whole, like, the complete information and that they take the decision based on that.
hmm Okay. Um, and the second one is a healthy diet is enough to keep hormones balanced.
And I think there's two parts. I think this is a good start. This is really part of the foundation. But I think something that we tend to forget again is our emotional and mental health. I know a lot of women who have such a beautiful, healthy diet, and they're like, I don't understand why I have these issues. And then I look at their life and they are like in chronic stress, constant chronic stress with their work or with their family situation. So I would say, yeah, healthy diet and a healthy lifestyle in general, but making sure as well that you tend to your nervous system.
I think one of the things that we're told as well is that there are basic factors that show that your hormones are imbalanced. One of which is if your period as a teenage girl, if your period is on time, it means that your hormones are balanced and everything is fine. Would you say that's accurate?
So I think it really depends, and this is where we have to go a little bit more in detail. It's a first step. Usually, when we have hormonal imbalances, our body will give us signals, right, or will tell us. But if a woman has like regular period, but she's spotting like 10 days in advance, so she's spotting after, this is a sign that something might, we need to investigate, and something might not, be 100% optimal, right? So it's not just about period being on time, but there are so many other factors. It could be, how is your gut health? How is your digestion? Do you, as I said, do you spot before or after? Are you identifying your ovulation? Do you know when your ovulation happens? Because you could have like a perfect 28-day cycle, but you could ovulate super late in your cycle and have a very short luteal phase that could impact your conception if you want to conceive a baby. So it's I think a first sign, but it's important to investigate a little bit more.
Mhm. Are there subtle external signs that we can realize or we can pick up on to show that there is hormone imbalance going on?
And that's the beauty, I think, with our body, is that our body gives us sign every day about where we are in our health. I think it's just about us listening and understanding what our body is telling us. So there are a lot of different signs in terms of the menstrual cycle and the period, but there are also, as I said, a lot of signs in terms of how your digestion is going, because our body is not like a mix of body parts, like a car that would like function independently. Our body is whole, and our nervous system is linked to our digestive system, is linked to our endocrine system. So everything is linked together. So usually when something is not right, you'll have a sign, or you'll have like a disease, or you'll have, something's gonna happen. Extreme bloating, PMS, extreme PMS few days before your period, constant headaches. There are a lot of signs that our body is giving us to tell us, hey, just stop, and you have to get, the root cause of it.
And it's important to recognize these signs because a lot of the times we just treat them with medication, right? And we don't actually go into the root cause of what's really going on. So I think it's very important also to know.
Yeah, I just want to touch on that, and it's often the case. Unfortunately, this is how modern medicine is treating, these, imbalances. Unfortunately, and I don't think they are equipped to really go into the root cause. It's like they're just treating the symptoms, or giving women birth control pill because it's gonna regulate your cycle, and then you're gonna forget about all your discomforts and ailments. But this is not healing. this is not healing. We're just putting a band-aid, on something without going to the root cause. Healing is really going to the root cause of what's happening in my body and treating it there so that it's sustainable and it really brings women feel the difference when you're treating the symptoms rather that you're really healing. Right. So it's exactly I really like that, the fact that treating the root cause is key, not just, getting medication to treat the symptom.
Mhm. The next one we have is postpartum depression is just hormonal.
Yeah, again, not at all. There is, of course, a hormonal. I mean, I would say women will experience postpartum like changes, or there is a hormonal aspect to it, but it's not a depression. Would be what we call the baby blues, and not all women experience that, of course, right? So this is definitely not hormonal. As I said, is really linked to the support that a woman has, that her experience as well, how she lives and how she perceives her experience, and of course linked to as well her birth experience.
And in your opinion, what are 5 myths about birth that are stripping women of their power?
So one that we touched upon a little bit is that your doctor knows better than you what is best for you. And again, that's not true. You're living in your body for probably decades at that point before you're pregnant. You're living with this pregnancy every single second, of the day. And I think again, we need to stop outsourcing our decision making and outsourcing the fact that someone else external to us knows better than us what is best for us. I would say that would be the first one. The second one would be that, yeah, whatever I do as exams, ultrasounds, etc., will guarantee me a positive outcome. We think that because we do an ultrasound, this is a guarantee that everything is right. And that's not true. I think we need to understand that an ultrasound is an image at that moment. It doesn't guarantee everything, anything, and nobody can guarantee anything. I think that would be the second. A third would be, oh my God, yeah, there's so many myths around, like, I cannot give birth to like a big baby. I think this is one that comes back a lot, right? Is like, okay, oh my God, my baby is too big. And I always say, first of all, what is a big baby? Who determines what a big baby is, right? A woman who is, I don't know, like 175 like a meter 75 and like 65 kilos, and you won't have a 2.8 kilo baby, right? Depending on your genetics, right? And I think we have to trust. It goes back to our trust. Our body will never grow a baby that is too big for us to give birth. It's impossible, right? So I think this is a big myth that we have to also talk about. I think another myth would be this whole due date. I think if we should like remove this due date from our head, I think it will solve a lot of problem. We could talk about a due month or like a season of birth, right? But we're given a date which is arbitrary, and I won't go into all the details, but if it doesn't happen at that date, we're like, oh my God, our body is broken. Something is wrong. We have to stop with this due date myth. This is really a myth. And again, we have to trust that our body and our baby will be born whenever she or he is ready.
Number 3 and number 4 really shocked me. It's definitely something that I've heard and I believe to an extent, because it is what we're told. But thank you so much, Hiem, for sharing that. I think this was such an amazing conversation filled with so much valuable information that, to be honest, I feel like we need to be touching on more often. But for the women out there listening, whether they're going through pregnancy, awaiting the birth of their baby, or whether they're going through postpartum, if you were to give them some piece of advice, what would your advice to them be? And if you like, you can give it to the main camera.
Yeah, so I would say the main thing is to connect and come back to our inner wisdom, because our body knows what it's doing. It's been doing that for ever. So I think coming back to our innate wisdom, that our body and our baby, they know exactly what to do. I think that would be the first thing. The second thing is that get you information from an independent source that can really support you and guide you and give you the right information about like pregnancy, birth, and postpartum. And the third thing I would say is to prepare, making sure that you prepare your postpartum, that you have a plan, that you create your village or your support community, that you have people that you can trust, that you can rely on during your postpartum.
Yeah. Well, thank you so much. Um, And, if you want to work with Huyam, we're going to put all of the links in the show notes below so you're able to reach her and start taking control of your own journey. As Huyam said, you have a lot of power, and sometimes we don't even realize that. So if you've enjoyed this episode, make sure to hit that subscribe button below, hit that like button, and share this with someone who might need to hear this discussion, whether she's going through pregnancy or birth or postpartum or even menopause. There is so much more in our control than we believe there is. And if you have a story to share, make sure to share it with us. You know where to find me. You can find me on Madinat Mom's Instagram. You can find me on www.madinatmom.com, or you can reach us on contact@madinatmom.com. Until next time, take care of yourselves as fiercely as you take care of your little ones.